Welcome to the Resilient Training Lab podcast.
What's up, everybody? Welcome to another episode of the Resilient Training Lab podcast. We're joined today by Eric Sokolowski. Eric is a certified strength and conditioning specialist, Doctor of Physical Therapy from the University of Hartford. He works at Gaylord Orthopedic and Sports Medicine in Cheshire, Connecticut as a physical therapist, and he's also an adjunct professor at the University of Hartford. So Eric teaches a course. It's called Advanced Exercise Prescription for the Physical Therapist. And so we'll do a deep dive today about exercise prescription, technique, and Eric's views on all the above. So thanks for joining us today, Eric.
Hey guys, thanks for having me.
So could you just dive in a little bit about this course that you teach at the University of Hartford for physical therapy students?
Yeah, sure. So I teach a summer elective course with the title that you just described. And I wanted to teach it because coming out of school, I didn't really get great, education regarding exercise prescription, which is kind of ironic because that's what we're supposed to be doing as professionals. And so I put together this course, and it is supposed to help arm future clinicians with knowledge on how to prescribe exercise and work with people in pain when you're bringing them through exercises. It's kind of a Trojan horse because, I talk about a lot of these other factors that relate to treating patients and not just exercise, but we go over exercise physiology, strength and conditioning principles. We talk about movement and coaching, which is probably what this podcast will kind of graze over, at least this episode here. Talk about pain education, pain and exercise. We go over low back pain, tendinopathies, and exercise for special populations, including geriatrics, people with osteoporosis, people with autoimmune diseases.
So I'm assuming that this course is geared towards dealing with specifically a patient, right? Assuming there's somebody in front of you who is experiencing pain.
Yes, but the first part of the course is pretty much basic principles, and you can apply those to people who aren't in pain or aren't recovering from injuries as well. And I think those principles apply really well to people in the clinic as well who are post-operative. Maybe someone just had like a muscle strain or sprain. If there's like clear tissue pathology, a lot of these exercise principles apply to both populations just as well.
Is that a common, misconception that you're frequently seeing, is that people sort of expect there to be specific rehab exercises that they should only be doing if they're experiencing pain or an injury versus like an actual, maybe something to be considered a gym exercise?
Yeah, that's a huge misconception. I think Legoy talked about this in the low back pain lecture where, there isn't necessarily typically special exercises for pain. And, you can certainly take these basic gym exercises, especially if that's what someone values, and scale it down to what their abilities are. And it can be an excellent rehab program with the added benefit of you're doing resistance training and getting all those benefits.
So if we're going to be scaling an exercise down, I would define that as changing the technique, right? And that's kind of the broad topic that we're hoping to cover today. So when it comes to working with somebody in a rehab setting or in a clinic, what would you consider to be your definition of technique?
It's kind of a broad definition here, but I would just say it's just the accepted way of carrying out an exercise task. And, the accepted way is kind of where it gets a little bit muddy because, accepted by whom? Is it the general consensus? Is it rehab professionals? Is it strength and conditioning principles? Is it a textbook? So, yeah, it's a gray area.
Absolutely. And so I'd love to just keep talking about it and hopefully understand a lot of the nuances behind technique. So specifically, if we were to talk about a deadlift for a minute, a lot of what's villainized is flexion, right? You can't deadlift with a rounded back. So if we think of a regular deadlift versus maybe a Jefferson curl, are there contexts where one of those would be appropriate versus the other? is the villainization of flexion appropriate based on the current literature? And how do you decide what your patients should be utilizing for their specific technique in the moment?
Mm-hmm. I'll start with the villainizing flexion because that will kind of set up the other questions here. So I would say the villainization of flexion is mostly unjust, and it's based on dogma, where, very likely people who were deadlifting with straight backs were probably doing pretty good. And then maybe they did a rep where they were fatigued and their back rounded a ton. And then maybe they hurt themselves and they're like, oh, well, flexion's bad. And, it's kind of a cultural thing at this point to not lift with a rounded back. And when you look at some of the research, looking back into, what causes, say, a back injury, we see that, these in vitro studies where they would take lumbar discs and stick them in an apparatus and have them flex and be put under load and go through all these conditions. And it was found that in general, these cadaver discs would either fracture or herniate, past, I forgot what the actual number is, but it was like 20 degrees of flexion. So, this information was kind of extrapolated to, mean that you shouldn't be lifting in flexion because flexion causes disc herniations. And then when you start to dive a little bit deeper into it, you realize that when you do squats and deadlifts, you're likely flexing your back well beyond this number to begin with. And, somewhere in the range of 40 degrees, which is double that accepted range based off of these in vitro studies. Not to mention that people tend to herniate their discs, not lifting in flexion to begin with. So there's a whole lot of gray area when it comes to lifting in flexion. And we just don't have a lot of data to say that lifting in flexion is going to cause more injuries than not lifting in flexion. So it's counterintuitive, but I think that's part of a cultural and societal acceptance thing.
So with a patient directly in front of you, and talking again about deadlift technique, let's say you do have somebody who is sensitive to flexion in this point in time. What are some ways that you would encourage them to change their technique in order for them to start to tolerate flexion again?
Yeah, that's a great question. So I think it's absolutely acceptable to change technique if someone's experiencing pain. There's nothing wrong with that. I think what you'd have to be careful with is the narrative that you provide. So if you go from being able to bend and lift however you want to all of a sudden flexion really hurting, you have to consider the person's fear and their belief that now bending is probably harmful to them. So if you temporarily change their technique to, say, have a more upright position and less of a flex position, you have to let them know that this is temporary. And, when you are over this injury, you probably don't have to worry about picking things up in a certain way. So, it's definitely okay to change technique based on symptoms. But I would probably go about it by changing the range of motion. So maybe they don't have to bend down as far, changing the load, changing the tempo, a lot of these things that you guys have already talked about on the podcast.
Yeah. So Paul, toss it over to you. Paul is joining us today. It's been almost 10 minutes and we haven't heard from him. But I know that in the past, you've dealt with some pretty limiting back injuries throughout the course of your powerlifting career. So what are some of the ways that you were able to change your training while you were experiencing pain so that you could still have a training effect, push your performance, even though the situation wasn't necessarily ideal?
Yeah, so as a powerlifter, the squat, bench, and deadlift are the three lifts you compete in. So being able to continue to perform those in some manner throughout the process was key. And that was just more modifying the exercise choice to find exercises that trained the movement that were less painful or tolerable, that continued to work, the positions and movements that we were trying to strengthen. So whether that meant bringing my feet up on bench press or raising a deadlift up off the floor to perform, block pulls, or switching to more like a front squat instead of a back squat. I was able to continue to train the movements and progress them without having to really switch my technique on the lifts. It was more just regressing the lift to a point that I could perform it pain-free and then continuing to progress it from there until I was at the point where I could do the lifts without pain. And there was one occurrence where I had a bout of back pain pretty close to a big meet that I was traveling for and already bought plane tickets to. So I decided to continue forth with meet prep, and by just controlling volume and load, I was able to, manage systems while peaking for a meet and still perform and, squat and deadlift over 600 pounds after really not being able to get out of bed, 4 weeks before. So it was more volume and load management and exercise prescription than anything that was modified.
And Eric, you're also a competitive powerlifter. You've total over 1,300 at 150, 152.
Something like that.
Is that something that you've experienced in the past too, or you deal with your own training?
Back pain specifically, or just injuries?
You can anything, yeah.
I have had my fair share of injuries, and I've had to change my technique multiple times, thinking that I was doing something effective when I likely wasn't. And I think this is probably a good talking point for technique and injuries here, is that when you are fatigued or when your body is guarding an area, like maybe stress shielding it, your movement changes. And let's take someone, for example, who, their back is really sore from deadlifting and they have to low bar squat, and they go to squat and their back is super sore. So, you mess around with your foot position, you try to get more upright, you try to do things to not load the back as much, and you end up changing your technique for probably the wrong reasons. And I've definitely been there before. And at that moment, I'm like, oh, well, maybe this is how I should squat. So then I would try to force myself to, maintain a certain technique, not knowing or not realizing that this was probably a very temporary change in movement that might not have, it might have been okay, but I probably didn't have to stick with that afterwards because it probably didn't actually contribute to, my injury risk. So I've dealt with my fair share of technique changes and injuries throughout my powerlifting career.
I think you hit on a really important point there, that context is key, right? So if you're experiencing pain, you might need to change your technique a little bit to be able to still elicit a solid training effect. But you also mentioned low bar squatting. And I know that squat variation is something that's highly influenced by individual variances. And so are there examples of maybe exercise techniques that are going to be more preferable for certain body proportions or limb lengths, or should everybody be trying to aim for the same exact technique for a lift?
That's a good question. So I think when we look at like what the accepted way of performing, say, a squat is, I don't think it's a bad idea to start with what you think might be appropriate. You have to have some idea of what this task is. So maybe you do start someone with, a little wider than shoulder width, and you let their toes come out a little bit, and you start with a low bar squat, and you do all these, little technique check boxes. And if you start to see, that the person is kind of shifting around and trying to find a comfortable position, then I would probably just go with that. But you have to start somewhere. But absolutely, the length of someone's femurs will matter. The depth of their hip sockets will matter. How long their torso is will matter. So all these factors do play into these individual variations. And I would say you should probably respect those a lot more than whatever your initial ideal of that movement is.
Is something like symmetry in a movement overrated too? Should the right side always match the left side or vice versa?
I think that'd probably be impossible to try to match a right and a left side. I think from the data that we have, asymmetry and muscle imbalance is kind of the norm. It's normal to have one shoulder higher than the other. It's normal to have the right side a little bit stronger than the left. We don't really have a great way of measuring these anyways, clinically, unless you have access to like handheld dynamometry or other equipment. So I think trying to maintain like perfect asymmetry or balance is just, chasing ghosts.
It's something that people are really concerned with outside or inside of a gym, but you walk out the doors of the gym and nobody cares about if they're driving their car symmetrically, right? Like one arm's out the window, the other's on the steering wheel, legs are flayed apart. And Paul, I know your squat is not symmetrical, but it's really good.
Yeah. So, I mean, I spent years trying to force my feet into a symmetrical position when I squat. And for years, I had the crappiest squat ever and dealt with lots of, hip pain and just never felt comfortable squatting. I mean, I pulled over 700 pounds and I don't think I could squat close to 500. So it was a big discrepancy between the lifts. And I was working with one of your colleagues, Eric Lagoy, who we had on the podcast a couple weeks ago. And he was kind of watching me squat and watching me move my feet around. And he just was like, hey, man, just put your feet in wherever they're comfortable and squat. And I did. And my feet were, very, very asymmetrical. My right foot sits about 3 to 4 inches in front of my left foot, and it turns out probably 20 degrees more than my left foot. And ever since then, I've been squatting without any issues and have hit a lot of PRs and have gotten my squat to catch up with my deadlift. So just the years of trying to force myself to squat in what I thought was an ideal position or the way that I saw, someone else very strong squatting in held me back, not just for a little while, for, 10 years or so. So when I finally let go.
Are you sure your leg's not going to explode eventually?
When I finally let go of that idea and was able to kind of come to grasp at, like Eric said, I wasn't going to explode if I squatted with my feet asymmetrical, then it really let me progress. And it's funny because anytime I go to a new gym and I squat, especially a powerlifting gym, someone always comes by and goes, dude, man, your feet, they're so uneven. You're going to get hurt. Every time without fail. I'm like, nope.
Well, I had that mindset at one point too,
Yeah, I mean, I think we've all been there. It's all where we all started.
Right. And I think any topic that we've covered in this podcast, we've likely spent thousands of hours on that specific topic in the frame of mind that we're completely opposite to now. What you had mentioned, Paul, is that you had repeatedly tried to force a technique on your body that wasn't necessarily its most optimal or efficient position. And so, Eric, are there consequences for trying to repeatedly force your body into positions that might not be the most efficient?
Well, I think Paul just outlined one. You're not going to squat as much, possibly.
Right.
So I think repeatedly forcing yourself into positions that are uncomfortable or trying to maintain the exact same technique over, your lifting career could potentially lead to overuse injuries. It could potentially limit your performance. So variability is normal and, it shouldn't be demonized. So I would say, yeah, there are some consequences, but, it's probably still, it's not as bad as people think either, to try to force yourself into, a certain technique, but you could be holding yourself back.
Yeah, you mentioned something there that I find interesting that a lot of people might not think about is changes in technique over your lifting career. And as you progress as a lifter, I know that my deadlift has just naturally taken various techniques as I grew stronger. And I was wondering if you had any kind of thoughts on that, reasons why that kind of happens.
Yeah, I think a big one is the skill level of the person. So when you start to learn a skill, let's take deadlifting, you probably have a ton of variation. Each rep looks wildly different than the other. You start to learn from these errors basically, and you refine your technique. It becomes more automatic. You settle into states and patterns that are comfortable for your body and can produce a lot of force for your body. And as you get stronger and as you get more skilled with the movement, it probably gets more refined. And I would say that just continuing to do what's comfortable, what allows you to do progressive overload, and what keeps you from getting injured for the most part, although I don't think that's completely avoidable, is probably a good goal. So I wouldn't worry about, trying to force yourself to stay with the same technique that you started with. And, part of the kind of the fun of being a lifter is to mess around with your technique slightly to try to see if you can optimize your performance over time.
Yeah, it's funny. As the longer I coach, the more I see that people kind of fall into that most optimal technique on their own, where you're just kind of trying to teach them some general concepts on like how to create tension through their body and, how to kind of get more consistent with their patterning. But overall, people tend to fall into the position that they feel the strongest in. And when we try and kind of change that dramatically, I think it ends up throwing people off and doing more harm than good, at least in terms of progress and efficiency.
Yeah.
I know for us, Paul, when we start working with somebody in the beginning, it's a game of sort of trying to peel back why they're doing what they're doing. And a lot of times they might be trying to do something with a specific technique because it's what they were taught, but it's not necessarily what feels best for them. So they may have been told that they need to, think of that old football coach when they're squatting, yelling at you to keep your chest up, and they're trying to keep a vertical torso while they're squatting down and they're holding themselves back and consistently missing depth. So Eric, in the clinic, are there ways that you try and sort of dive deeper into why somebody's doing what they're doing and whether or not, they're performing an exercise a certain way because your eyes are on them or because it's what feels most optimal and comfortable to them?
So in the clinic, I try to set people up with their exercises in a way that I really don't have to coach much at all. So I definitely used to overcoach and I used to overanalyze. And in a weird way, sometimes I think people value that. They think they're getting, like really good tips or techniques, or it's going to help them in the long run. But what I do now, and this is based on, research in motor learning and dynamical systems theory, if I can set someone up to, perform a movement that I want them to perform with minimal coaching or no coaching, then, the person's probably going to learn that skill and become a little bit more independent faster as a result. So take, for example, teaching someone how to squat and, their heels are coming up or, they're tipping, backwards or they're tipping forwards. If I can set up the exercise in a way, let's say I give them a kettlebell to hold and out in front so that it kind of counterbalances them. I stick a box behind them so that they have to sit back onto the box. It kind of forces them to get into the positions that I want them to get into without me having to coach them at all. So I don't know if that answered the question at all, but that's, how I try to set up people's exercises to begin with.
Yeah, there's a lot of good research looking at that and having people using external cues and having people kind of be able to figure out the process on their own and how they learn from their mistakes better kind of in those environments where instead of just shouting cues at them and screaming at them different directions, because one, while a person's in the middle of movement, they're hard pressed to change that movement. The changes that they do make aren't really processed the same way as subconscious changes. So we are just doing them a disservice when we're screaming cues at them the whole time. And from a strength standpoint, if the person's working hard enough, and you scream a cue at them and they try and do it, it's just going to mess them up because there's no room for error when you're working at like an RP8, RP9. Like let them finish the set and then talk to them after, or put them in an environment that makes them more successful, or choose movements that work on, the areas that they need to work on. Don't just shout techniques at them. And I think this is something that we run into a lot with people that are new, is they're fearful of hurting themselves. They've seen, everywhere that if they do something incorrectly, that they're going to get hurt, and that lifting is dangerous, and that they need that coach there to be screaming cues at them the whole time to make sure that they don't get injured. And I think that idea is a little far-fetched. So you'll shed some light on that, Eric.
Yeah, so I can see a little bit the appeal of that, because giving someone a ton of feedback during, with internal or external cues, if you hammer someone with those, then the performance in the short term does improve. And I think that's where people fall into a trap, because if you shout a whole bunch of cues at someone and, the person seems to respond even moderately to those in the short term, we have research showing that in the long term, it's actually a detriment to learning the skill independently. So for long-term learning, you have to let the person get into positions that maybe they have to correct, or they have to self-organize, or they have to basically adapt on their own. And, it's probably not a bad idea to give someone some cues afterwards and kind of like let them know how they did. That's for long-term learning versus kind of the short-term, just shout cues and hopefully see if something sticks.
Yeah, I'd be interested in knowing if even the shouting of those cues in the short term, if that's just like an arousal state response, right? You're like, oh, somebody's yelling at me, I need to pull harder, or whatever the exercise is, right?
And a little bit of regression to the mean there too. I mean, if someone's messing up and you shout at them, chances are they're going to be doing a little bit better because you're shouting at them because they're doing it wrong. There's, lots of studies on that too, with
Sure.
Kind of positive and negative appraisals.
Yeah, and I think you brought up a great point, Eric, when you had said that people start to sort of expect or value being over coaching, at least in the beginning. And I know that we really try and explain ourselves, but help the people training with us to understand that there's a reason that we're often silent, and that, like Paul had said, we're not making changes at RP8, because at that point you should only be focusing on execution the way that you know how, and then building them up over time to understand why we make changes, or how we're going to go about making those changes. And it's not just about shouting at somebody while they're while they're working out. And then the next thing you had said was that these people aren't going to be successful independently if we're constantly doing that. And so I know that we're always trying to create people who are confident enough in a gym to walk in and hit their workout without needing a coach, because we're not always going to be there. And so in a clinical setting, that's the ultimate goal of a clinician, right? Get the person out and hopefully not have to see them again. So are there other ways that you try and create independence with these patients of yours?
Yeah, there's a ton of ways. And as far as movement is concerned, and, exercise and technique, when I can set someone up, the way that I described, where I have to use minimal cueing and coaching, I do things to boost their self-efficacy. Like I'll give them feedback that they did well. I will give them some autonomy on exercise selection. That's really a big one. I will kind of give them a little bit of space, so I won't just kind of hover over them while they're doing exercises. And if I do these things, at a nice pace based on the individual, they start to be more confident, thinking that, I don't need to have someone watching over me. I can get through these workouts or these exercises and I can feel fine after. Another big one is just letting them know that if they do get sore or feel worse after an exercise session, that it's okay. And I give them guidelines relating to that as well. So I'll give them exercises at home too that they've done in the clinic, and have them report back on that. So that gives them the opportunity to complete some of these movements independently.
Is one of the common obstacles you encounter with that people being worried about doing whatever you ask them to do wrong at home?
I don't get that as much anymore because I really don't emphasize technique nearly as much as I used to. So, if someone is worried about doing something wrong, I try to squash that as early as possible and letting them know that as long as it feels okay and you're progressing, it's probably not wrong. So that's a big point of emphasis that I try to make known right away.
Yeah, something we talk about all the time is, efficiency versus, injury risk. And a lot of times people come in and they think they think that the reason that they're taught certain techniques is because it's going to mitigate their risk of injury. But when in reality, the reason we're teaching them and the reason why we tell them that we're teaching them certain techniques is because it's going to be the most efficient way for them to move the most amount of weight or for them to perform. So when we're getting feedback, we want to ask, like, how does that feel to you? Like, does it feel good? Does it feel efficient? Do you feel strong in that position? And not just try and, again, put them in the positions we think they should be in.
That's a great point. People definitely need to be given that information right off the bat. I'm assuming in the strength and conditioning world that we're coaching you for this reason. Injuries are going to happen. And if they happen a little bit less because we have a good plan in place and, you're being managed from a fatigue standpoint, then they're probably going to be set up with the right mindset from the get-go.
Yeah, I think that goes a really long way in creating consistent effort, right? Because that's the best way for these people that are in front of us to make progress and change their lives is to consistently be doing the plan that we set in place to help them get where they want to be. And one big concern that I've also seen in the gym is people getting very concerned with variation between reps, either during the same set or throughout the workout. And I know earlier you had mentioned that if you are experiencing a lot of maybe soreness or fatigue in your lower back from a deadlift session, and then you go to change your squat stance to maybe more optimize the way that you're feeling that day, that can be acceptable. In my mind, what I'm always looking for when I see somebody doing a challenging set is how much is their technique changing from beginning to end and set by set. So is that something that you're looking at in the clinic, or do you have any insight on maybe what's an acceptable level of variation versus maybe when you try and call a set short or cut a set out of the workout?
Yeah, so I guess in the clinic, I will use symptoms as my guideline to whether or not I will cut a set short. And the symptoms is still based on what the tolerable level for the patient is. So let's say someone is doing a deadlift in the clinic and, we're working around lower back pain and they get one of their reps in a wildly different position that they were in for the first couple reps. And they notice that they, after that one, they have a decent amount of low back soreness that they're not comfortable with. Yeah, I'll stop the set. I'll coach them out of it. I'll give them a good narrative. I'll try to put a positive spin on it and we'll kind of get right back to it. But as far as variation in terms of performance in the absence of symptoms, that's not something that I'm really concerned about. So as you fatigue, your body's going to try to find efficient ways of completing the task. And as long as you're completing the task and you're not getting symptoms and you're able to progress, say you start in a back squat or even in a deadlift and, you have a nice neutral looking spine, the air quotes going on right now. And as the set goes on, your back starts to round a little bit more, but you complete the last rep. It was like an RPE 9. It was supposed to be tough. That's not something I'm worried about. I'm considering that something normal. As you fatigue, your efficiency changes, your body's trying to find ways that can still complete the task. So that's a really long-winded way of saying that I'm not worried about individual variation between reps in the absence of, major symptoms.
Paul, when you're coaching a client and you see a lot of variations happening from the beginning of a set to an end, what is your thought process like, and what's your approach to talking to the person about it?
Well, it depends on the context. Usually you're going to see that more in beginner lifters, and they're trying to figure out what feels best to them. So, each rep looks a little bit different, and you might go up to them afterwards and talk to them about which rep they felt was the best and help them kind of figure out what they were changing subconsciously, like, because you have a better coach's eye for that thing, and they're just doing these things because they're trying to figure out what feels good. But if you can pinpoint which reps felt the best and start to figure out with them why those reps felt the best and point them in the right direction, so they can start to kind of self-organize those different positions and be able to, again, be more confident on their own to perform them. That's what we're looking for in a new lifter. But in a more advanced lifter, if there's a lot of variation between reps, like Eric said, it's probably more due to fatigue or them, having some lingering fatigue from the day before that they're trying to, again, deal with by changing their technique a little bit. So I'm a little less worried when I see, an advanced lifter making drastic changes. And you'll see that, the more and more of an advanced lifter, you won't really see any changes because they get more skillful at their technique. Like when I lift with Carlos, who totals over 2,000 pounds, his rep that he fails on his AMRAP looks exactly like his first rep. It's just slower. It's like he's just so efficient at his technique, and it's so efficient for the way he moves the weights that there is no really technique change from first rep to last rep. I guess that's what separates, a beginner from one of the best powerlifters there is.
Yeah, that's what I was hoping to get out of that. Is the bar speed is really the only thing that changes the more advanced you are, hopefully. But it's not uncommon, and my favorite example of it is like with a beginner lifter, if they're doing a set of 6 on bench press, they might almost fail the third rep because their technique is so wonky they can barely course correct. And then reps 4, 5, and 6 look easy again, and they don't know what to call it for an RP because like, oh, well, that was really hard. But they have to figure out if it's hard because their technique was inefficient or if it was hard because they were actually close to like muscular failure.
I could say too that when I have someone, I'll take that kettlebell deadlift example, say someone is dealing with low back pain and their technique goes from, whatever, a straight looking back deadlift to a rounded looking deadlift. And the person points that out to me like, oh, my back rounded a ton. I'll ask them, how to feel. And if they said it felt fine, then I'll say, great, your back rounded and you were still able to lift it comfortably. That's a really good sign. Your back can handle lifting in a flex position and you can be safe. So the more positions that you can develop capacity and strengthen, probably the better. Like you have more tolerance in these positions that you might not be able to avoid in day-to-day life. Or if you fatigue under heavy squat and you fold over like a pancake, but you're still able to complete the rep, it might not be the most efficient way to complete a 1 rep max, but now you've at least you're able to grind out something that looks terrible and likely walk away without an injury. And that's really not the worst thing. You probably have capacity in a ton of different positions, and I see that as a good thing.
Yeah, the West Side guys were all about that. They called it like chaos training. Put themselves in horrible positions and see if they could get out of them. I don't know if they did it in the smartest way, but they had the idea.
Well, and again, when you're talking about horrible, you just mean inefficient, right?
Yeah. So let's say, you're squatting and you're relatively upright, and on the last rep, you fold over a little bit, but you're still able to complete the rep, and then you feel fine after, and it's no big deal. I don't see that as necessarily a bad thing, and it's probably not always avoidable unless you're Carlos.
And when the West Side guys kind of took that and said, hey, people folding over in squats, let's, put them do good mornings starting from pins where they're folded over. So if they get into that position, they have some capacity there. Something that we've kind of mentioned a few times, and we've thrown some air quotes in, and we've talked about that idea of a neutral spine. And as humans, I think it's something that, or as trainers, it's something that we as a whole kind of talk about a lot. But as humans, I don't think we quite are as good at perceiving what neutral is as we think we are. And Eric actually mentioned the study earlier where people were doing their squat and hinges, and they were having about, I think it's like 30, 40 degrees of spinal flexion. And the kicker there is that these people were trying their hardest to move with a neutral spine, and the observers, observed them as having a neutral spine, yet they were still in this, again, air quote, danger zone that people have come up with due to that cadaver research that Eric was also talking about. So you hear us talking about quote unquote neutral spine or someone perceiving their back going into rounding, but really our perception of all of that is not as good as we'd like to think.
Correct. And I don't think it is a bad thing to shoot for that. You can coach that type of position. But if you fall out of it, I wouldn't worry about it, is I guess what I'm getting at.
When you're talking to your students, is this a conversation that you're frequently having about the nuances of the exercises might look a little bit different, and we actually might not be so good at knowing exactly what we're looking at?
Yeah, we touch on all these things, and this is the hardest content for my students to grasp, just because they come in with the Kelly Starrett, type ideal of movement, where if you fix your movement, then you'll basically fix your patient, and it definitely does not work like that. But we go over dynamic systems theory because it gives a really good foundation of how to look at movement. And from there, we talk about variability and error and how it actually leads to learning and possibly reduced overuse, injuries. We talk about a lot of misconceptions too, because that's a big one where we didn't touch on this yet, but let's say that someone is running on a treadmill and, their hip is dropping and their knee is caving in, and you think, hey, maybe their glute med is weak or something like that. And if you strengthen the crap out of their glute med with a single leg squat, then their running should improve. That's just not what we see. We see a person single leg squat improve a ton, but that's a big misconception, is that you can change some type of impairment like strength or mobility or stability or something, and you could just all of a sudden see that carry over to someone's exercise technique in a different context, and it just doesn't work like that. And that's really hard for students to grasp, because they're taught that if you find a mobility or strength deficit and you work on it, their movement will improve and the patient will get better.
Yeah, and I think we see that in the strength and conditioning world a lot too, with all these different movement paradigms, and kind of every kind of camp has their ideal way of how everyone should move. You have the PRI crew, you have the FRC crew, you have the FMS crew, whatever other letters they have, and they all have these kind of paradigms of what movement should look like. And I think when people get too far down that rabbit hole, they end up doing their clients more of a disservice than the benefits they think they are, because all of these things are just conceptual theories.
Bullshit.
Yeah. I mean,
just say it, man. Just say it. It's bullshit. It's not based off of anything other than the person's experience and maybe some theory, right?
Yeah. Yeah, and then coaches will say, oh, because of my personal experience with this stuff, and this stuff is true, when really it's probably more the beliefs and expectations you're pushing off on your clients that are making your biases come to fruition.
Yep, that is confirmation bias 101. So say like a coach or a trainer they have an athlete who is under a ton of fatigue. Maybe they have a crummy program and they can't get into, say, a good squat position just because they are so fatigued. Maybe they have hip pain. And one of these FRC, FMS, PRI guys can come in and basically stop them from training, work on all these fancy corrective exercises. The person feels better because they haven't been under heavy load for a while. All of a sudden they feel better and they're moving better. Oh, well, it must be because of XY technique or XY special exercise or breathing. And they might look and feel much better. But when they end up going back onto a crappy program, all this same stuff is going to happen again.
Yeah, I can think specifically of maybe a group of coaches that were really about the FMS. And then when the legitimacy of the FMS was called into question, they just jumped on the FRC train and, without adjusting their programming. And so this is going back to talking to your students, when technique is something that there's so much variance in, and this simplistic view of, if somebody's movement isn't what we see in a textbook and there's a strength deficit, let's work on that strength deficit and then everything will be all fine and dandy. If that's not the approach that we're taking or you're taking as a clinician, what do you specifically try and instill in your students as principles, whether it's related to exercise or adherence or whatever the subtopic would be? What are the principles that you really try and drive home so that your students can be successful clinicians?
Yeah, that's a good question. And I guess in this context, when it comes to looking at technique and movement, I would say my emphasis to help them be successful is that you have to understand a lot of the nuance behind movement and coaching so that you end up doing less as a clinician, basically. So you have to know this stuff well, and it helps you understand that a lot of the stuff that you might have thought is probably wrong, and you get to focus on other things. So if you know that, movement screens aren't really predictive of injury, or fixing a movement screen won't fix a person, changing someone's strength and range of motion isn't necessarily going to get them better, you get to now not have to focus on those things, and you get to focus on the big picture stuff, like looking at fatigue, stress, fitness, looking at their self-efficacy, trying to get them to adhere to something. So basically, you don't have to worry about these little kind of movement impairments and strength impairments that probably don't have a big impact on this person's recovery. And then you can kind of focus on big picture. So that's one of the big points of emphasis in this movement lecture that I give. And it's a hard concept because I would think that, and I've got this feedback from the students, that a trainer or a therapist, then, then I'm not really doing anything. And that's not exactly true either. There are people who do need guidance, and they need motivation, and they need a good program. But, you're quote unquote not fixing them. And that's a big kind of paradigm shift that I'm trying to get across.
I kind of want to run with that a little bit. So another thing that we hear a lot of is that they need to like you said, strengthen certain muscles to fix compensations or do specific drills to make certain muscles function in a certain way, or to feel certain muscles while they do an exercise, or I'm lumping a bunch of different examples in here. Or like, they're not feeling X while they squat, so they need to regress it because they should be feeling whatever, their quads when they squat. I want to talk a little bit about those ideas. I'll give you a specific question so I don't just make you pick up nothing. Let's start with that idea of compensations and having to regress to do drills to make your muscles perform the way they should. So the question is, one, can we tell what our muscles are doing? And two, are there certain muscles that need to be stabilizing, air quotes, and certain muscles that need to be main movers? And do we even have control over what muscles are functioning during a heavier lift?
I would say that the short answer to that, at least the last part, is not really. From a performance standpoint, you don't need to necessarily feel certain muscles working for them to improve their strength, or in some cases their hypertrophy. If the body is compensating because of fatigue, and say it's stress shielding a fatigued hip or fatigued knee, and you change your movement and you don't feel it in that spot anymore, it's not something that I'm worried about for long-term progress. I would say that a caveat here could be a bodybuilder who they are worried about symmetry and muscle imbalance, and they're not feeling whatever their glutes when they're trying to do a glute bridge, and they feel it on their hamstrings. That could be an instance where changing their technique and getting a mind muscle connection, air quotes, might be more beneficial. But I would say I'm not concerned about the other stuff in all other contexts.
Yeah, from a strength coach standpoint, you pretty much nailed it. It's like when we're talking about strength and performance, I don't care what you're feeling as long as you're performing at your highest level. And to be perfectly honest, if you're really pushing yourself, you shouldn't be able to tell what you're feeling. Like when I'm doing a heavy deadlift, I can't tell you what muscles I feel. All I feel is like my head's going to pop off my body. Like, like all I can think about is not dying. I'm not thinking about what I feel. So if you're really driving output and you're worried about what you're feeling, then you're really not driving output. But if you have, accessory work where you want to work on a specific muscle, or you're a bodybuilder, or just someone that wants to build muscle mass in a certain area, might we want to concentrate on feeling that area or choosing exercises that you feel those muscles working? Yes. But when it comes to output and strength and performance, like if you're worried about what you're feeling, then you're really not driving output.
Yeah, I 100% agree. And I do the same thing in the clinic. You'll see therapists or coaches, and someone's doing like whatever, let's just say a TheraBand row, classic, and you see the overcoaching therapist. They're pointing to they're giving like a tactile cue on their shoulder blades. They're saying, do you feel it here, do you feel it there? That's not something that anyone should be concerned about.
Yeah, I think that ends up in that paralysis by analysis type category, where we talk about this a lot, at least from a strength and conditioning standpoint, is you're just increasing the barriers to fitness by overcomplicating stuff that doesn't need to be overcomplicated. I guarantee you nobody cares about, feeling their left adductor and right oblique or whatever when they're doing a Bulgarian split squat. Like, like just do the split squat.
Your left adductor.
Yeah. I'm going to breathe because you don't know how to breathe.
Yeah, like
right. Yeah, your left adductor is functioning as a prime mover and not a stabilizer.
Like it doesn't matter, and you're creating problems that aren't there, and you're creating fear around movement that shouldn't be there. And really, in the long run, you're probably, doing more harm than good by creating these fears and these beliefs with the information that you're putting out there. So it's really important as strength coaches and physical therapists to be careful about the information we're putting out there, the narrative we're attaching to that information, and looking at the bigger picture consequences. You might think that it's not harmful to overcoach and post videos of you making people do exercises in a hyper specific way, but other people see that and they think if they're not doing it that way, it's wrong. And again, you're just creating barriers to fitness, and you're creating fear around movement that doesn't need to be there. And I do understand that, in that context, it might have been, appropriate. That person might have wanted to play around with those techniques or whatever it may be, but it's more about that narrative that you attach to that message than anything.
I'm with you 100%. And I'll add to that a little bit, that if that stuff did matter more or to a significant degree, we'd have data showing that. But we have plenty of research showing that people's, movement or quote unquote dysfunctional movement doesn't have to change for them to get better or for them to perform well. There's an example in the therapy world a diagnosis, I guess, called scapular dyskinesis, where the shoulder blade sits in a certain position and it moves in a different way than the expected ideal, we can say. And when you look at people with this quote unquote condition and you put them through an exercise plan that's very specifically designed to change that movement and strengthen certain muscles and not work other muscles, people get better. People end up getting stronger, their pain goes down. But then when you assess their movement afterwards, it doesn't really change. So if focusing on these little things actually mattered, we'd have a pretty robust amount of evidence showing that, and we don't.
Yeah, and those groups, they kind of get better without any intervention too, as well.
Yeah, I mean that's a whole different story. But yeah,
You just brought up scapular dyskinesis, right? And we've already talked about spinal flexion. What I'd really like to do is just lob you a bunch of softballs about maybe some different common myths or different movement patterns that people are really concerned about,
sure.
and just hear your take on them. And so this one is, I guess, specific to squatting. But are you concerned when you see somebody's heel lifting up off the ground when they're performing a squat? And what are some of the changes that you might make to their technique?
Yeah, so in a beginner lifter, I will probably try to fix that, because if you can be able to produce force through as much contact area as possible, it's probably going to be more beneficial in the long run. So I might teach someone, I mentioned this already, with a box behind them so that they're sitting back. Or an external cue would be, stick your butt back to the wall behind you, something like that. Or pick your toes up inside your shoes is kind of decent cue, at least in the beginning, to get them to feel their weight, what's happening in their shoe. If it's an elite level athlete and their ankle mobility just won't allow it and never will allow it, and a squat shoe won't correct that, and their heel comes up a little bit, it's probably fine.
So viewing squat shoes as cheating isn't actually a fair assessment, and it's not always about how much ankle dorsiflexion you have. Your ankle structure matters.
Yeah. Fair assessment.
How about knees going over the toes? Are your knees going to explode?
God, I hope that's still not a thing anymore. Yeah. I mean, they kind of have to for you to get into a deep squat, especially, high bar squat. Yeah. No.
Is it even possible to squat without your knees going over your toes?
Or
play sports, or cut, or
I've seen Instagram videos of people like squatting straight in front of a wall, and it just looks ridiculous. And like, who the hell can like load that?
Definitely not something to drive output with.
Yeah, you'll watch them do that, and then you look at the video before where they were performing their lift, and it doesn't look like that.
Yeah, not at all.
It's just like
but if you are blowing up a balloon while you do it, then you might unlock the next level of movement.
Yeah. What about knees caving in while somebody's squatting? Is that something to be afraid of?
Knee valgus. We were talking before we started the podcast. Amanda Lawrence, people love to rip her apart. But as far as I know, she doesn't have a knee injury. Her knees cave in a ton. That's just an efficient way for her to squat a ton of weight. And if you had discomfort on the inside of your knee when your knee caved in a ton, yeah, it might not be a bad idea to coach out of that. But if that's where person has built up capacity and that's where they're strong, I'm not going to coach out of it. A caveat would be if someone is maybe at risk for an ACL injury and they're playing a field sport and they have certain characteristics that when they cut and land and do those kind of more dynamic movements, that might be something that you want to coach out of, but not squatting. No.
Yeah. At least in the weight room, it's probably not that big of a deal. In terms of the knees over toes and knee valgus, if you ever watch any successful Olympic lifter lift, when they catch a clean, their knees are as far over their toes as you'll ever see.
Yeah, they kiss each other too.
Yeah. And then when they stand up from said clean, their knees will literally touch. Like,
I was talking about the knees, by the way, not the lifter.
And, these are high level athletes. And then the spinal flexion example that actually Eric Lagoy shared with us was, the big jump snowboarders and skiers, the ones that go off those huge jumps in the X Games. And when they land, they're literally like face hits the snow and they're like bent over and max spinal flexion, absorbing force from like 100-foot drop. And they live to tell about it. So
yeah, they thrive, right? They're not just living, they're performing at the highest level consistently in that position.
Yeah.
Are there any other ones that you want to bring up, Paul? Any other positions?
I think the other one, in terms of bench press is elbow position and wrist position, and, flaring your elbows and being able to tuck your elbows and benching with a neutral wrist versus a more flexed wrist.
Mm-hmm. I mean, I'm going to default back to some of the other kind of guidelines that we talked about. If a certain technique, let's say with your elbows not flaring as much, maybe touching a little higher than you might expect, is comfortable, and that's what makes the person end up being able to progress with, that's not something that I'm really going to change or coach out of. However, you can certainly mess around with, getting into a bent wrist or a neutral wrist, or tucking the elbows more. If it ends up feeling better and if it gets the person to push more weight, then I'd say that's a worthwhile endeavor to try to change technique. But again, I think we talked about it. The person is probably going to self-organize and find the position that's most comfortable and strongest for them.
Yeah. So the example I always use here is Jenn Thompson, so best bench presser in the world, and her elbows are like at 90 degrees when she touches her chest. And according to strength coaches around the world, she would not be a good bencher because of that, but her numbers say otherwise. And then with the wrist position, as a coach, I'm not too concerned about whether your wrist is bent or straight. I'm more looking for the bar to be kind of stacked over your elbows so that you can push maximum amount of force into the bar and not lose any with some weird angles.
I feel personally way better with a really bent, extended wrist position. And I've tried correcting it a couple times, and I feel worse with it. I can't push as much weight. So I just kind of,
Yeah, I'm in the same boat there too. And that's another thing that, every time I'm at a new gym benching, that's another, one that everyone is like, hey man, you got to straighten your wrist. You'd be able to bench a lot more. And I can guarantee you I've tried and I can't. And then the last one that I wanted to touch on was kind of butt wink and hip shift in the squat. I think these are two things that I see lifters obsessing about and trying to like constantly get rid of.
Well, we did allude to this before, where even if it looks like you have a neutral spine when you squat and deadlift, you're probably in a lot more flexion than you think. So when you do finally get deep enough into a squat and you can actually see spine position change, it was probably happening before anyways. So, if it's not uncomfortable, it's unavoidable. So whether or not you can actually squat deep enough to see it is just based on the person. So I'm not going to change it. And we don't have any good evidence to say that if we do change it, then the person's all of a sudden going to have, a more robust back or a heavier back squat or something like that.
Yeah, I know you guys are talking about wrist extension in the bench relates to your bench. That relates to my squat. I am just very comfortable in a more flex position and at the bottom of my squat. It always happens. It always has. And I spent years trying to fix it, and several people will just be like, oh my gosh, you can't do that. Like, you got to just put a box down. You can't go lower than this point right here. And it ended up just creating more problems worrying about it than the actual, I guess, seeing the butt wink was creating.
Yeah.
So at the end of the day, I guess, so my takeaway from this conversation is really the techniques that we're using can vary a lot, whether it's anatomical, whether it's context specific and intentional, if somebody's experiencing symptoms in a certain position, moving out of it. And what's going to be a bigger driver in what somebody's experiencing with their pain symptoms or performance is going to be more of a exercise selection, a load management, and more structured training approach or changing your training approach is going to have more of an outcome than maybe some of these non-modifiable factors that we talked about. Is that fair to say?
Yeah, I think that's a pretty good recap.
Yeah, I think we covered some of the, one-liners that I always find myself saying, and they all kind of come to fruition here. Is your beliefs about deadlifts being bad for your back are probably more detrimental than deadlifts themselves. Is one thing I always say. Your expectations and your beliefs kind of drive your reality is another thing I say, which we've talked about a lot here. And the third thing that I always say is that it's more about your ability to tolerate load in the position than whether the position is good or bad, which I think we also touched on here. So
yeah, I think we can all agree on that for sure.
All right, Eric, if somebody's looking to get in contact with you, what's the best way for them to reach out from you or learn more from you?
So I do have an Instagram, which I don't use a ton, but
except to post great memes.
Yeah, except for memes. That's where I make my exception. Eric.soko.dpt. That would be probably the only way. Other than that, you can call Gaylord when we reopen and see me if you wanted to, if you're dealing with pain or injury, but you guys already have a different Eric for that. So
lots of Erics.
Yep.
And I saw you included a very nice Tiger King meme in your PowerPoint for your students, right?
You got to stay current. It's the only way you can connect with your students.
He had to switch all his old Game of Thrones and Bird Box memes to Tiger King memes. So.
Game of Thrones seems like years after, doesn't it?
Yeah, you'd think with this quarantine, somebody would want to maybe rewatch it, but season 8 just took all the interest out of rewatching it for me.
All about Tiger King and Corona memes right now. So.
All right, awesome. Well, Eric, thanks for taking the time to talk to us today. That was really awesome insight, especially from somebody who's so involved in the profession and in the field and trying to just better everybody that he comes into contact with within the field. So thank you.
Thanks for having me, guys. It was a ton of fun.
Thanks for coming on.
If you enjoyed our podcast, we'd love some reviews. I don't know how many we're at now, but more is always better.
You got to review it on iTunes, people. It only counts on iTunes. All the other services don't have reviews. So subscribe and review and give it a 5 stars on iTunes. We love the shout outs on Instagram and Facebook too. But hit it up with that review.
Thank you for tagging us in all your stories if you're listening. We appreciate it. We'd also appreciate a review. So thanks for listening, guys.
Have a good one.